So neonatal jaundice, as you know, affects about 60% of term babies and about 80% of preterm babies worldwide. In Ghana, it is said to affect about 67% of newly born babies. As has been said, it is important to advocate to talk about it because if you miss it, it might cause the life of the child. It might cause the child to lose the sight. It might cause the child to lose the vision. It might cause the child to lose the hearing, and it might cause the child to develop cerebral palsy. That is why we are advocating for the neonatal jaundice in this month.
Okay. And for this year, our program started in the Upper West region. On the 5th of May, there was the national launch for Yellow Month. Following that, we had the health worker training, which was held by the Bono and Bono East regions. And today we are here because we are having the national stakeholders meeting and the newborn jaundice fair.
We also have two additional programs that will be held. One by the water region team, that is engagement with the heads of nursing and midwifery training institutions. That will be on the 26th of this month. It will follow up with on the 27th, another activity that's report from all the regions on Yellow Month. We now call on Dr. Najama Glover to give us the purpose of this gathering.
Thank you very much, Hannah Sharon and Dr. Isel. A warm welcome once again, everyone. Today, my job is quite simple, just to give the purpose of gathering for our event. But I'd like to take us a few steps back to a couple of years. PSG noted that one of the main contributors to acquired neurodevelopmental delay among our children was severe jaundice. National figures looked exceptionally high, especially compared to other jurisdictions. As advocates of children, therefore, we set out on a mission about 5 years ago to educate and equip everyone, healthcare workers, parents, society. That was how the Newborn Jaundice Awareness Month was born. In this short time since its creation, most of us can attest to seeing more newborns with jaundice a bit earlier than we used to, giving us an opportunity to adequately manage and prevent long-term damage. In fact, a facility actually attests to a drop of from up to 14% down to 4% of deaths from severe jaundice. But we haven't gotten to our main aim yet. Our aim is 0% bilirubin encephalopathy in Ghana. And so the drive continues. And today, Greater Accra is hosting various cadre of healthcare workers and members of society to dialogue and further strategize in our aim to reach our goal. If you are represented here, it's because you can help us on this journey. So come along with us. Let's save a newborn one step at a time. Let's do so together at today's stakeholder meeting. You're warmly welcome. Thank you.
Okay, thank you very much, Najama. Okay, so now that we know the reason why we are all here, we'll continue with our program. We're going to watch some videos which will tell us about some messages from various institutions. So we'll start with the Ghana Medical Association.
Medical Association and a member of the Pediatric Society. I would like to take this opportunity to wish the society well in this month's stakeholders meeting on jaundice. Jaundice is an important issue that has to be discussed, especially among newborns, because of the implications in terms of morbidity and mortality and the effects jaundice has on the brain development in the newborn. As GMA, we are also in support of the drive to secure phototherapy machines to all hospitals to ensure that at least we are able to prevent the ill effects of neonatal jaundice. I would like to commend the Pediatric Society of Ghana for choosing to deal with this important topic of neonatal jaundice, especially in terms of prevention, early identification, and early intervention to prevent the untoward effects of neonatal jaundice. I wish you well in your deliberations and assure you the support of the Ghana Medical Association. Hopefully, I will join you in the discussions so that we can all have a very fruitful ending to this wonderful project. Thank you very much.
Good evening, colleague healthcare professionals. I invited guests and all distinguished ladies and gentlemen that have joined us at this very important Newborn Jaundice Awareness Month for 2022. For the past couple of years, the Pediatric Society of Ghana has found it very necessary to highlight a major critical issue that affects our newborn babies on a yearly basis. And this year is no exception. The Pediatric Society of Ghana has decided to highlight the challenge of newborn jaundice. And the theme for this year's stakeholders meeting is Survive and Thrive from Yellow to Hero. To me, it is very appropriate and timely considering the number of newborn babies that suffer from the devastating effects of jaundice, and sometimes some have even lost their lives. I think that it is very, very timely. It is a laudable project that the Pediatric Society of Ghana has decided to embark upon to create awareness, to educate the populace, and to ensure that together we all fight to ensure that the newborn baby survives, thrives, and grows to be a healthy individual that can contribute effectively to the building of our dear nation. Therefore, I am very excited at this meeting that is taking place. And I, as the Regional Director of Health Service of Greater Accra Region, continue to assure you of my regular support, including all my team, in ensuring that we join hands with you to ensure that the education goes to every corner, every community, right to the lowest level. Because if our mothers are well educated, families are well educated, they will understand some of these challenges, and as soon as they see anything like that, they will immediately seek for healthcare services. And I want to believe that as healthcare professionals, we also continue to ensure that we upgrade our knowledge, provide the needed services that they will need when they come, so that they continue to have the assurance in our service and seek our help as and when it is needed. So on behalf of my team at the Regional Health Directorate, on behalf of all the health workers in the Greater Accra region, and on my own behalf, I wish to say a big ayiko to the Pediatric Society of Ghana for this noble, laudable project. And I hope that we will all ensure that what we have embarked upon, we will achieve the objectives, and we will also have very fruitful deliberations in this meeting. Thank you all, and God bless you all.
Good afternoon, august audience. On behalf of the President, the executives, and the entire membership of the Ghana Anesthetic Society, I wish to express our greatest pleasure and honor at the invitation extended to us to be part of this important event. As a body, GAS, that's the Ghana Anesthetic Society, has long admired the Pediatric Society of Ghana for its devotion to duty and purpose, advocacy presence in the eyes of not just your fellow professionals, but also to the general public, especially with your increasing social and traditional media campaigns. I must confess that you are an inspiration and a yardstick we use as we also forge on in marketing our professional body and plan for an Anesthesia Awareness Month in the near future from our current World Anesthesia Day, which is commemorated every 1st of October. Just as your neonatal Jaundice Awareness Day has matured, developed, and attained the requisite milestones, I'm using your usual balance, into a month dedicated to this purpose. Neonatal jaundice remains a major cause of admissions in that age group and a source of worry to not only clinicians, but also families. And I'm not limiting this to just the mothers, but at times the grandmothers and other family members are equally, if not more worried than even the mothers. We have also encountered an episode of this one way or another in our social settings. I've had to give reassurances or directions, correct misconceptions, and call colleagues in neonatology for guidance and appropriate referrals. It is indeed distressing as we are aware of the potential bad outcomes without appropriate prevention and timely interventions. Despite advances in medicine and public education, like we're doing now, there still remain many myths, like the healing prowess of instilling breast milk into the eyes of affected neonates, or the efficacy and effectiveness of any available blue light. Occasions like this are a great opportunity to dispel them. One such myth is that anesthesia is a cause of neonatal jaundice and invariably its subsequent complications. Indeed, our anesthetic agents and techniques have been associated with an increase in neonatal bilirubin levels, but prevailing evidence strongly suggests that this does not lead to the development of neonatal jaundice or the requirement of any intervention. Conflicting evidence also exists as to which anesthetic agents or techniques have the greatest association with an increase in bilirubin levels, or whether these observations are even spurious. Regardless of the myths, be assured that anesthesiologists remain key players in the management of neonatal jaundice, with compelling evidence alluding to this. Therefore, even as we create awareness about neonatal jaundice in the month of May, the Ghana Anesthetic Society pledges its support to this awareness campaign and will continue to contribute wholeheartedly to the prevention, early detection, and management of neonatal jaundice and any attendant sequelae. Thank you very much for your audience, and we will portray all our points in the subsequent stakeholder forum. Thank you.
Big Ayuko to the Pediatric Society of Ghana on creating a nationwide awareness on neonatal jaundice. The theme for the year, Survive and Thrive, reminds me of the countless number of children with a past medical history of neonatal jaundice who have survived and are thriving beautifully because of a timely intervention from health workers like you, especially physiotherapists who identify these children at the neonatal intensive care unit and follow them up until they are 1 to 2 years to ensure that they are achieving their developmental milestones. But for those with developmental delays, the physiotherapist also starts early intervention to ensure that they still thrive. The Ghana Physiotherapy Pediatric Interest Group commends your efforts. Yemamunyina Ayiko. God richly bless you.
Good afternoon, ladies and gentlemen. My name is Perpetual Freyampofo, and I'm the president of the Ghana Registered Nurses and Midwives Association. We are grateful to the Pediatric Society of Ghana for this invitation to be part of your Yellow Month stakeholder meeting under the theme Survive and Thrive from Yellow to Hero. That's a very interesting one. I bring you warm greetings from the National Council of the Association and want to commend the Pediatric Society of Ghana for this initiative to have a whole month in creating awareness and drawing the attention of all stakeholders and the general public to the issues of neonatal jaundice. As we know, as health professionals, we have what it takes to indeed allow our neonates to become heroes and not just stay in yellow. We understand the causes, the treatment, and the prevention of neonatal jaundice better than any other grouping. And therefore, I want to encourage us all that having the knowledge of what it takes to treat or manage neonatal jaundice, we must continue to work together to ensure that we create the enabling environment for our neonates to survive and thrive and indeed become heroes. Education is key and engagement is also key. And we have to continue working with the mothers to ensure that those that can be prevented in terms of the types of neonatal jaundice, we actually prevent them and also work together to treat or manage those that fall under physiological jaundice so that our babies can be happy. On this note, I want to say thank you again, and we wish you a very successful meeting. God bless us all.
Hello, everyone. This is Linda once again from the Ghana Journalists Association, and would want to commend the organizers for putting the stakeholders engagement together. Last year was awesome. Despite COVID-19 restrictions, we're able to have something virtually. And this year, I'm happy we are having an in-person meeting, while some will be joining virtually. It's just unfortunate that neonatal jaundice is still the leading cause of preventable brain damage, physical and mental disabilities, and even early deaths among infants. Why should it be so? Something that is preventable. And I believe that as stakeholders, we have our various unique roles to play in ensuring that this is prevented. And we'll have children born free without jaundice. These children, we all know, will grow to become some important personalities in future. And as the theme for this month says, survive and thrive from yellow to hero. They need us to become the heroes and heroines that we want them to be. And together we are in this fight. I equal to all of us, and I believe that together we'll win this fight. Thank you very much, and God bless us all. Bye.
As the president of the Ghana Medical.
So, thank you very much. So as part of the video, we are going to watch another video. This actually, okay, all right. Okay, good. All right, so we are going to continue with the messages. And at this juncture, we'll call on Dr. Pabi to give me the message from PSG. Dr. Pabi is a consultant pediatrician who works with the 37 Military Hospital. Please give a clap for Dr. Pabi.
Thank you.
He's also the Assistant General Secretary of PSG. He's one of our bosses. He's a big man. And he's a personal friend too.
Thank you, Kojo. All protocol duly observed. And I would like to, first of all, thank my president, Dr. Donadebi Apia, for giving me the opportunity to stand in and give this message from PSG on his behalf. So as we are all aware, PSG, we are in the interest of children, and because of that, for this month of May, and in fact, for the past 5 years, we have kept this flag flying by advocating for babies with neonatal jaundice with our theme Yellow Man. Our theme for this year is Survive and Thrive from Yellow to Hero. We want all newborns to have a chance to thrive, even if they become jaundice, because we are so much aware of the numerous problems that babies that develop jaundice tend to encounter. What are our targets as we continue with this advocacy program? We aim at educating the general public because the children will come from the public, from the communities. So we want everybody in the community to be aware of neonatal jaundice and its effects on the newborns if it is not handled appropriately. We also aim at educating the healthcare professionals in order to improve our skills in detecting babies with neonatal jaundice and also knowing how best to handle them so they do not suffer the consequences that otherwise they would have suffered if they are not managed well. Then most importantly also, we aim at advocating for equipment and laboratory support for all health workers in all facilities that handle newborn babies. In fact, all our effort will come to naught if we don't have the necessary equipment and the laboratory support to help us manage these babies. For sometimes, with just your naked eyes, you may not be able to estimate the level at which a baby is jaundiced. And because of that, you need the laboratory support and the equipment necessary for you to detect it early and manage it aggressively in order for these babies to thrive. In fact, it is our prayer and hope that at least for now, all the 200 and something district hospitals or hospitals that we have will at least have one phototherapy equipment, a very effective one, that we are sure that once we're able to detect a baby having neonatal jaundice and you put this baby under this phototherapy equipment, you are sure to get the utmost result from it. So we hope that as many people have been supporting us over the years, they will continue, corporate organizations, individuals will come on board and support the Pediatric Society in standing and fighting for these newborns who are very vulnerable. On this note, I thank you all. You're all welcome, and I wish you a fruitful day in discussion. Thank you very much.
So we introduced earlier on a very beautiful lady. We think we have to add a little bit to her credential. Okay, so that's Dr. Nana Jama Glover. In fact, he's a pediatrician. She currently works with University of Ghana Medical Center, and actually she was the past General Secretary of the Pediatric Society of Ghana. So Nana Jama, thank you very much for representing the PSG. Okay, good. So as part of the team today, we said that survive and try from yellow to hero. We are going to show you a video of somebody who had or developed neonatal jaundice, who was treated by the doctors, especially I think it was in Confidential Teaching Hospital, and she's now doing big things. Please watch the video and you understand it yourself.
Hello, good afternoon. Please, I'm your personal tutor, and my parents are Mr. and Mrs. Sudan, and I'm 21 years old and a student of University offering tourism and culture. Please, I am a newborn jaundice for a neonatal survivor, and I started school from Marches of Uganda, and I continued my business at Chrysler Education Complex. Then after my JHS, I went to HHS at Adventist Senior High School, and now I'm in West University. And when my parents found out that I was infected with jaundice, they rushed me to the hospital. That's why I got treated. So when you find out that your child has been infected with jaundice, please rush the child to the nearest hospital so that he or she will be treated.
So my name is Anthony Enemel. I'm privileged to sit with now my daughter, but she used to be my patient some years back. About 21 years ago, I remember in January, 21 years ago, I was the house officer on duty at Mothers and Babies Unit here in Ghan, when her mother very desperately brought her 3-day-old daughter who was very yellow the child was jaundiced, and it was a challenge because I was just a new doctor, but I had that as a baptism of my competence, even though I hadn't done that before. So we worked around what's the right blood to match, and we were able to successfully do the testing blood transfusion. Now she's sitting here in the level 200 at University. Just to assure everybody that if your child has jaundice, the important thing is don't delay. Don't keep the child at home. Don't put the son in sunlight saying it will clear, because this has caused a lot of problems. Some children have developed neurodevelopmental delay, and they haven't been able to achieve what they could have done just because they didn't take advantage of resources available. So urge all mothers, newborns, if you have a child who is jaundiced, please don't stay home. Report early to the hospital. And if interventions are done early, the child can go on to develop as normal as any child. Just as today, young lady here is an example. Now in KNUST second year and doing very well. So we wish everybody a very happy World Jaundice Month. Thank you.
Thank you. So ask me.
January 6, 2001. Who break it here, that's me. I'm a bear yellow. And be receive from Echo. After Dr. Connie, passed out. It's on that. The best in the new. And 6 months to come, I'm on a show. And for the man, 6 months after 6 months, I'm a person of money. As me, I am a baby. When to me, no one, 2 years. 2 years, 3 months, as not meeting me actually. Me valid, my funny, my people, and I am a watching a man. It's nice.
Okay, so as we've seen, if you have a child or a newborn with neonatal jaundice, irrespective of the way they present, you can always do more for the baby. You can always do more so that this child might survive and might become a very big person in the society. So don't give up. Please diagnose them early. Send them to the right places. Let the doctors work on the babies, and then we'll get good results.
Okay. So now we are going to deviate from the program a little bit. Okay, I'd like to call on Nurse Akosia Sewa Jenin. She's going to talk to us a little bit about her experiences with nursing babies who have neonatal jaundice. So please let's welcome her with a warm round of applause.
A very good afternoon to everybody. I think I've been taken a bit unawares. I was just informed, but I have to try and say something. So with my years of experience in a tertiary facility, let's say Kolebu Teaching Hospital, I came across a lot of children, let me say, neonates who had jaundice. Some were mild, some were moderate, some were severe. And from stories or from my interaction with the mothers, which my friend even happened to be a victim, she's a nurse, but her firstborn happened to suffer this jaundice, severe form. Baby later became kineteric, had cerebral palsy that later affected a whole lot of things about my friend. I took up the challenge to every morning organize something called a jaundice class, where I met the mothers, their husbands, grandmothers, all the other family members, so that we discussed this jaundice. And throughout my classes, I got to know that people still had this notion. I once met a man who nearly beat up the wife because he said the wife likes groundnut soup a lot when she was pregnant. So she gave birth to a baby with jaundice. Some people also thought the mango, the oranges were giving the baby jaundice. Some people didn't even have any idea about the jaundice at all, and they thought the jaundice the children do experience is the same as the jaundice they have in their adult life. So I realized that education is what was lacking somewhere. So it was a very wonderful opportunity when Pediatric Society started this whole jaundice month. And over the years, I think the number of cases that reported to the emergency room in Kolebu with neonatal jaundice, statistically, I can't quote, but I can see the numbers have quite reduced. People still have few challenges out there because of the issue of sunbathing, where you go to health facilities and some health workers still think sunbathing is the option when the babies have jaundice. So as part of our jaundice month, I think the education is still ongoing. People will change their mind. I moved from Kolebu to Ghana Health Service just this year. And traveling outside Greater Accra, I realized that the message is not out there as we have in Greater Accra. People still believe in sunbathing. At most of the places I visited, they still believe in putting glucose on the eye, giving some to the babies to drink to make them get well. So I think generally it's all about the education, and the education, we are part, the people out there, the market women, everybody is part. I chanced on the market woman last week. She was wearing a jaundice t-shirt. So I asked her, Madam, where did you get it from? She said, I'm in the question and me try any the chair me. So I asked her, do you understand what is written in front? She said, yes, yellow hospital. Then I just quickly remembered, now Jama did this church quiz, so I knew where the person was coming from. So I think when we all get involved, this whole thing about sunbathing, this whole thing about neonatal jaundice will come down, because there are real challenges. But with all coming together, I think we can move from yellow to become heroes. Thank you very much.
Okay, so let's acknowledge all the people who have joined us online and on YouTube. We've seen great people online joining us. We'll see our president, Dr. Adebi, appear online. But President, we salute you and the good job you are doing for Mother Ghana.
Would also like to say thank you to every member who has joined via Zoom and those watching us on YouTube. Before the roundtable discussions, we'll take time to introduce the stakeholders who are physically present and on Zoom as well. So we finished with part one of our program. We're going to start with the second part. Time is fast spent. So for this, we are going to call on Dr. Cyprian Beme to introduce our chairperson for today. So Cyprian.
Dr. Cyprian Beme is a PSG Greater Accra president. Please welcome him.
Thank you very much. I'm quite excited about this section of the meeting. I think this is the meat of the meeting, and I'm glad to introduce the chair. The chair for today has several years of experience working as a clinician and then later at the national policy level of the Ghana health sector. She's currently the Deputy Director of the Family Health Division of the Ghana Health Service. She has coordinated the development and revision of a number of documents and guidelines, including the National Child Health Policy and the National Newborn Health Strategy and Action Plan. She has also contributed to several other service policies, protocols, and guidelines in Ghana and globally. She is a fellow of the Ghana College of Physicians and Surgeons, a member of the Pediatric Society. She has served as a part-time lecturer at the School of Public Health and also at the University of Ghana. Our chair dedicates a significant part of her time to social and behavioral change communication activities. So I'm glad to introduce Dr. Isabella Segomoses as our chair for the event. May we have your response, madam?
Thank you very much for the introduction, and thank you to the leadership of Pediatric Society of Ghana, the Greater Accra branch, for asking. Actually, the invitation was to the Director of Family Health, and he did accept to be here, but has to travel. So he's outside Ghana as we speak, and I'm happy to step in for him. Always very excited when it comes to things of children. Let me start by congratulating the society for this move that has been sustained for the past 5 years. It's doing a good job, and we are beginning to see the results. This afternoon's roundtable is centering on two very important aspects of the work that we've embarked on. How can we disseminate and sustain knowledge on newborn jaundice, the causes, early detection, and appropriate management at all levels? The dissemination is going on, and as our colleagues said earlier, there's so much misconception still around, not just among the public, but among our own health workers. So we need to continue to disseminate. But I really like the part about sustainability. Having been in this field of spreading knowledge for several years, I get convinced every now and then that it never ends. It never ends. I take an example with breastfeeding. We started way back in 1993, and yet still we come across instances where it's like we've done nothing. So let's never give up. So we are really tackling a very important aspect, and I hope that the panel discussion will bring out some important issues and recommendations to help us sustain this move. And then how do we ensure equitable distribution of resources needed to manage neonatal jaundice? I believe that the panelists will also look at, first of all, how do we mobilize the resources before we distribute? Because we are very far from having enough of what we need in terms of equipment, human resources, and so on, to effectively manage our newborns who come down with jaundice. So I am excited, and I'm really happy about the stakeholders that have been identified to delve into these two very important aspects of our advocacy and efforts to address neonatal jaundice in Ghana. With that, I'll say I'm excited, I'm happy to chair, and I know that you are all already with me to make sure that we have a successful discussion. Thank you very much.
Thank you very much, Madam Chair. Okay, now we are going on to the main event for today. We are going to have the roundtable discussion. But before we do that, it's important that we know who is participating in this discussion. So we are going to introduce the various participants. We have 2 questions for our discussion, and we have members from various institutions here today. So first of all, I'd like to introduce our representative who is a traditional leader, and she is in the person of Nakoko Ajoyi the First. She's the Queen Mother of Adabraka. She's worked with the graphic for the past 40 years and was installed in 1998. She's an Anglican and has a passion for women and girls. She also has a foundation which cares for the health and education of girls, and she's a newborn champion. So now, Nakoko Ajoyi, the Queen Mother of Adabraka, we welcome you. Thank you for being here.
So the next member of the panel is going to come from the Ghana Anesthetic Society. He's in the person of Dr. Jonas Auku Afare. He's a specialist anesthesiologist of the Kolebu Teaching Hospital, currently secretary of the Ghana Anesthetic Society and representing his association. Country lead for anesthesia team for Operation Smile International. They have a modest amount of pediatric anesthetic experience in their mission through the length and breadth of the country. And he's also a certified pediatric advanced life support instructor. Please let's welcome Dr. Afare.
Okay, we also have a representative from the Ghana Physiotherapy Association, and she's in the person of Mrs. Delali Logosu. She has joined us via Zoom. She's a physiotherapist and an academic manuscript editor. She works mainly with children who have neurologic conditions, and she has more than 7 years of experience. She also edits and reviews manuscripts for health science researchers with English as a second language. She's had more than 2 years of experience in this field. In addition, she also mentors a group of editors to improve upon their research editing skills. Delali also holds a master's degree in physiology and a Bachelor of Science in Physiotherapy, and is a certified manuscript reviewer. So Delali, thank you very much for joining us via Zoom to represent the Ghana Physiotherapy Association.
Okay, so the next to join the panel is Dr. Charlene Fatima Gilbert. She's the head of Greater Accra Regional Hospital, and she's also a pediatric intensivist. She's a mother of 2 wonderful girls. In fact, they are now adolescent, I think so. Dr. Gilbert, please, you are welcome.
We also have Dr. Peter Kwatin. He's a pediatrician with a passion to use evidence-based approaches to improve health systems in child and adolescent healthcare. He has special interest in health system strengthening, and he seeks to use the added knowledge in public health to help improve child and adolescent healthcare in Ghana. Currently, he works as a health and nutrition specialist with UNICEF Ghana, and his roles include maternal and child health care interventions, which include quality of care, kangaroo mother care, immunization system strengthening, outbreak response, and resilience building in health systems. He's had past roles as an implementation committee chair on the Tamale Teaching Hospital local project implementation team for the Ministry of Health, and has also been a trainer for the Ghana College of Nurses and Midwives. So Dr. Peter Kwatin, I think he's with us via Zoom. So thank you very much for joining us.
So the next to be introduced is Dr. Edward Entry. In fact, I know Dr. Entry way back. I was looking for employment in Greater Accra, and I met him at Ghana Health Service, that's Greater Accra regional office. Today we met, and it was wonderful. So he's the National Program Manager for Ghana Health Service, in charge of newborn and child health. He holds a PhD in clinical epidemiology from Utrecht University, Netherlands. Dr. Entry, please, you are welcome.
And the WHO is strongly represented by Dr. Rosalind Dansuado. She's an obstetrician gynecologist by training and a public health specialist. She's a fellow of the West Africa College of Surgeons and holds a master's degree in public health. She's also an advocate for women's, newborns, children, and adolescent health. She has had several years of experience working as a clinician in obs and gynae and also as a public health specialist. She's currently the officer in charge of maternal and child health at the WHO, the Ghana country office. And this is a position she has occupied for the past 6 years. She's married with 3 lovely children. Dr. Do, thank you for joining us via Zoom. You're welcome. And last but not least, I'd like to introduce Akosia Sika AEC. She's representing Dr. Mrs. Charity Sapon of the Greater Accra Regional Health Directorate. She's the Deputy Director of Public Health at the Ghana Health Service and is a public health physician specialist. She has extensive experience in the fields of maternal health, child health, epidemiology, and disease control. And she was actually a newborn care coordinator for the region some years ago. Since the onset of the COVID-19 pandemic, Dr. AC has been the operational team lead for the Greater Accra Regional Incident Management Team for the most populated and highest COVID-19 burden region in Ghana, the Greater Accra region. As part of the response, she has also worked with the regional team to ensure sustainability of essential health services, which include maternal and child health. Her keen interest in health system strengthening continues to be her driving force in addressing the various public health issues she encounters. Dr. Akosia Sika AEC is married with 4 daughters. Dr. AEC, thank you for joining us.
Thank you. So the next I'm going to introduce is Dr. Amma Kaki Ghani. I also know that Dr. Ghani. In fact, I think I know a lot of people. Dr. Ghani is formerly of the Greater Accra Regional Hospital. She's a specialist obstetrician and gynecologist of the University of Ghana Medical Center. She's the National Treasurer of the Society of Obstetric and Gynecologists of Ghana, and is currently pursuing a fellowship in gynecological oncology in the University of Cape Town. Dr. Ghani, thank you very much for joining us.
Thank you. And then from the Muslim community, we can't forget Madam Hafsatu Mohammed Salisu. So thank you very much for being here with us, Madam Salisu.
Hadia, thank you very much for joining us. Do you know that most people who say they are newborn champions or they are whatever, the doctors, they were actually pediatricians, but decided to join other profession. You know that? Yes, they love the children. So that's why they're going to help us to discuss the awareness. So very, very important. If you ask Hadia will tell you that she loves children. That's why she's here. Okay, great.
Okay, so thank you all very much. We'll move on to the roundtable discussion. We'll go to the first question. And for this, we'll have the representative from Pediatric Society of Ghana, the Ghana Registered Nurses and Midwives Association, our traditional leader, the media representative, and from the Ghana Physiotherapy Association.
So today, and for the discussion, the roundtable discussion, I hope you are all ready, those seated here and those joining us via Zoom. The first question that we are all going to discuss is that how can we disseminate and sustain knowledge on newborn jaundice, causes, early detection, and appropriate management at all levels? So we'll read the question again. How can we disseminate and sustain knowledge on newborn jaundice, causes, early detection, and appropriate management at all levels. So you're going to start this by asking Dr. Gilbert to set the ball rolling. Dr. Gilbert.
Thank you very much for inviting me to be part of this panel. Just a small correction for political correctness. I'm not the head of the Greater Accra Regional Hospital. I'm just the head of the Department of Child Health.
Oh, sorry. Yeah, that is it. Yes.
I'm sure everybody knows that, but just.
Yes, please. That is it.
Yeah.
Thank you very much.
That's okay. Anyway, so to the question of how do we disseminate and sustain knowledge? Okay, so I think that on a national scale, our training institutions are the first place. So pre-service training is a key point where we can intervene and emphasize on the importance of neonatal jaundice in reducing neonatal morbidity and mortality, and actually improving the long-term outcome of our children and our general population. So it should be highlighted in the curriculum of all healthcare workers that deal with newborns. So our midwives, our nurses. Now, at least we have neonatal nursing training. Medical school, it's already part of the curriculum. And of course, for postgraduate training, that goes without saying. But I think the bulk of the newborns' first experience of healthcare workers is our midwives. And even in some areas, traditional birth attendants. So the training must really, really be emphasized at that level so that they can appreciate the importance, would be able to pick up babies with risk factors for early follow-up. We'll be able to identify babies with jaundice for appropriate referral. And we'll be able to educate the mothers in the antenatal clinics so that even the mothers are also aware. So I think that the midwives are the core when it comes to neonatal jaundice, because if we are able to get it right with them, then the bulk of the job will be done. And then building on from there would be to ensure that all medical officers are able to identify jaundice in newborns and be able to manage appropriately. So training pre-service is important. And then also in-service training, just refresh us as we go along, and especially for new staff that's joined various facilities. I think as we draw the in-service training program for the year, for the relevant staff, newborn jaundice should always appear each year until we are able to achieve our targets. And we are happy that it's become a part of us, that we don't need to be revisiting frequently. But I think at least for the next 5 years, at the minimum, it should be on every hospital's in-service training agenda for each year, for our midwives, for our nurses who are running up antenatal clinics, the postnatal clinics, and even the child welfare clinics. But usually by when they get to the child welfare clinics, they are past 6 weeks. And that's just a tiny bit of the children who get jaundice, and that's those who are prolonged. But the bulk of the babies we are talking about here are those who essentially would even be less than 2 weeks old. So our midwives, I cannot overemphasize the importance of training our midwives appropriately. With regards to management on all levels, like Pabi said in the beginning, if we identify and we cannot manage, then it's just as bad. So making sure that phototherapy and effective phototherapy units, for that matter, are available in all our district hospitals, so that when these babies are identified, even at a sub-district level and referred, they can be managed at district hospitals and not have to travel so far for just phototherapy. It destabilizes the whole family when a baby has to be moved far away from their community just because they need phototherapy. And it also actually discourages the families from following through on their referrals. If the hospital is so fine, they think the baby is stable, and then they'll go home and do the sunbathing and come when it's too late. So all our district hospitals must have effective phototherapy. And then as we climb higher, we must have high intensity phototherapy to reduce our exchange transfusion rates, because we all know how scarce a resource blood is. And for a newborn, we want fresh, whole blood. And of course, blood comes without risks and all of that. So we really would want to minimize our exchange transfusion rates. So if we have high intensity phototherapy, then at the higher levels, our level 2A, level 2B neonatal care units, then at least it will minimize the number of exchange transfusions we do and even improve outcomes, because we know that even after an exchange transfusion, the baby still needs intensive phototherapy. So not just phototherapy, but effective phototherapy on all levels, so that these babies can access care that is effective, as close to home as possible. Supplies that we need for managing babies with severe jaundice is sometimes a challenge. And healthcare managers and must also be in the loop so that they appreciate the need for some of these things. And they are not even expensive for most of them. Okay, so even things like three-way taps sometimes are a problem. So even as we talk about the lights, we should also remember that there's a group of children who may need an exchange transfusion, and the catheters we need, the blood we need, the connectors we need also need to be available at our regional hospitals. Thank you very much.
Thank you very much, Dr. Gilbert. I think some important points have been raised. Most importantly, is that we need to start education right from the beginning. So it's important that all healthcare workers, nursing students, medical students are educated properly on neonatal jaundice, so that it's easy for them to detect babies who have neonatal jaundice, so that the appropriate interventions can be put in place.
That's very good. And she's also mentioned getting the right equipment and making sure that they are working very well. Phototherapy units, and that's so that it prevents exchange transfusion, because it's also come of its own challenges. So with this, we want to ask now Koko Ajoyi the first, the Queen Mother of Adabreka. Now, please, what can we do in the community to enlighten the mothers on newborn jaundice? Thank you, Na.
My name is Na Koko Ajoyi.
Okay.
Ajoyi.
Ofane. Na Koko Ajoyi the first.
Yes.
Ofane. Thank you very much. Oyi waladon.
I don't know what that is. With us in the community.
Yes, please.
Normally, me like this, I can't speak Tree properly. So when we go out to educate the people, I speak Ghan enough. And they want to speak Tree, when they ask some questions in the Tree language, we don't understand it. In the community, we have to tell them, when you are pregnant, you visit the hospital. And I even told them that there's a pregnancy school in Adwanka Polyclinic where you will be educated. When you are pregnant, you have to take a lot of fruits. And you know, some people say when you are pregnant, you shouldn't take egg. Now, when you tell them, some say they've never heard of yellow month or newborn babies with jaundice. And they are asking the question, how do you determine the baby has jaundice? And me, I'm not a health worker, but I don't know how you can determine it. I asked somebody, he says, when you press the forehead, you see the yellowish at the forehead. So that's what I tell the community people. Then some will ask you, our mothers, they were giving birth, they don't have jaundice. Why is it that now we are having the jaundice? Maybe it's the antenatal we go, the medicines they give us. That's why we have jaundice. You know, in the community, there are a lot of people don't understand health properly, but we are trying. With the market women, we normally go to the market and talk to them as a champion. That's what we do in the community.
Excuse me, please, can I add to it? I think when we talk about the community, we are talking about institutions, organizations. We are talking about the religious bodies and others. And so if we are going to have a very good dissemination, it means then that we should have a very strong strategy that will ensure a very strong engagement with these various associative bodies within our communities. Because when you go to the market, the market woman is a market woman at the same time she's a member of a church, and she may be a member of a women's group in the community or others. So we can also we could also identify some focal persons within these areas, and then maybe take them through some training, and then afterwards ensure that they become the mouthpiece within our communities. And then we monitor their DOA, that's their daily plans of action, to see how best they are making impact, and then look at how much we can update their information so that they don't need to be too technical. They just need to have the basics, the essential basics that can help mothers. And then another area I think we can help is also our schools. Some of the children are very, 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 very vocal. And some of them, because of the educational level of their parents, they can also be very good points for such engagement where the children can also be trained. So we can also find focal points within our various schools, like the basic schools and others also, maybe from GSS or late primary level, class 6 going, for them to look at how best they can also help their mothers. Because for a child like that, if she's the primary child, that the first child, then it is possible that the younger ones there, they can help their mothers really be able to monitor their children and even educate their mothers on neonatal care and others. Thank you very much.
Okay, thank you both very much. I think those are very, very true. It's never too early to start learning. So as early as basic education, we can start teaching older children how to detect neonatal jaundice. A lot of the time in our hospitals, we may have children who come in, the child is newborn, and then it's the older sibling who is helping the mother to take care of the child. So if they also know how to detect newborn jaundice, will go a long way to help early interventions and treatment. Thank you very much. Okay, so Hajia, please, can you add to what has been said so far?
I think what I also can do is, in my Zongo community, we can use the Zongo media houses, like the Maraba FM, the Gaskia TV, and then some faith-based organizations in the Zongos, and we can use the chiefs and the imams, maybe during the sermon at the big mosque, that's where the Friday sermon is held, and then the everyday mosque with some sermons, and then we can use our schools. As Madam said, some of the children are vocal, so we can use our Arabic schools, and then we catch them young, then we start educating them. And I think with your collaboration, I can champion that cause. In Ghana here, we have Federation of Muslim Women Association of Ghana as form work, and we have our umbrella organization throughout the country. So we can use that to disseminate information. Thank you.
So yes, as Haja has said, we are using the media houses, the organizations in the community, the faith-based, and all, they are going to help. But other group of people that I think they are also important are the artisans, okay, the beauticians, very, very important group, okay, the hairdressers of beauticians, and also the dressmakers. They are very, very important If we involve these people, we educate them, they have their associations, they do their graduations, they do all these things. So during these graduations, we can actually involve ourselves, talk to them, because they are the mothers who are going to bring forth to these babies, and they're going to help us. In fact, even in their salons, they can also introduce this topic to the mothers that come for their services, which is going to also help us spread the news. Thank you very much, Hadia. And Madam, please, you didn't introduce yourself, so we will be happy if you could introduce yourself, please.
Sorry, please. My name is Cecilia Ama Anderson. Before I went on retirement, I used to work with World Vision as the National Coordinator for Child Rights and Protection. And then when I left World Vision, I set up my own NGO, and I collaborate with Ghan a lot on her work.
So please, we have a dignitary in our midst. And when she spoke, you could imagine where this were coming from. The experience is enormous. Great, thank you, Madam.
Okay, so now our next representative is going to join us via Zoom, and she's in the person of Madam Delali Logosu. She's a member of the Ghana Physiotherapy Association. And before she speaks, I'd just like to acknowledge Mr. Cosmos Yafi. He's the General Secretary of the Ghana Physiotherapy Association. So Delali, if you could please unmute and give your contribution to this question. Thank you. So Delali says she's not unable to unmute.
Okay. So there's something that Nas said, and also Hajia also mentioned, that I think is so important for us to talk about. And it's about the language that we use to educate people in the community. Recently, I did a program on one of the television stations, and it was in English. When you got to the question and answer segment, everybody who called in said that he wanted to speak in Akan or Ghan or something. So what it tells me is that you don't go educating people in these languages. My boss is here, Dr. My boss is here. No, she's a very powerful woman, and when it comes to doing advocacy and all that, and anytime she asks me to help her, I tell her that, oh, I prefer going to the local stations. It's because you can get a bigger reach. They will understand what you are saying, and then they can use it to educate other people. One important thing, the school children, very, very important, because sometimes they can spread the message to their parents, as you've been spoken about. Thank you very much.
Okay, so Delali has been able to unmute. So Delali, please, you can go ahead.
Okay, thank you very much for this opportunity. So to add up to what Doctor said, I think that as we discussed earlier, the main issue or the basic place where we should target is our health workers. Now, one major thing I was thinking about is the use of flyers. But then I was asking myself how effective flyers have been over the past in disseminating information. And mostly when you look at flyers that have been developed in the past, the focus is on text. You see too much of text and less pictorial information. So considering the target group that we want to reach, I think if we decide to go the flyer way, we can focus on developing flyers that are more pictorial based, so that when someone takes a glance at it, it's so easy for the person to know what leads to jaundice, how jaundice is neonatal jaundice is identified, and where to go when you identify anything like that. And I think more focus should also be on the prenatal period. Most mothers, okay, I won't say most because I don't really know the statistics, but pregnant women attend prenatal care. prenatal classes. So I think in that moment, the focus can also be, or one of the topics that can be treated there is neonatal jaundice, how harmful it is, and what can be done to prevent it. Probably if we are able to paint the picture of how the impact it has, the impact neonatal jaundice has on the child's livelihood, that if it's not treated at an earlier stage, or if it's not dealt with earlier, the impact it has, like it's leading to cerebral palsy and other neurological conditions. Probably if that picture is painted well, it will make it easier for mothers to understand the gravity of the issue and then do something about it. Yes, so that's the little contribution I have towards this topic. Thank you.
Thank you, Delali. So the pictures, we need to paint the pictures very well so that the parents can actually get to know the message. It's also important, as she said, that we need to talk about the antenatal. When we go to antenatal, some of the important things that we need to mention during antenatal is the use of camphor and even the mothers knowing their blood group. Okay, so camphor is quite common amongst our mothers because most of us, we were born. After we were born, our parents actually kept the cord sheets and all those things. They preserve them with camphor, isn't it? Or the adocodone, isn't it? Yes, they preserve them with adocodone, and then they will use to be used for the next baby. Okay, and sometimes these children, especially if it's a boy, might come down with GCG deficiency, and just by getting into contact with the clothes, the baby will start hemolyzing and develop jaundice. So camphor is something that we need to educate the populace in terms of that. So important. Camphor and GCG deficiency and neonatal jaundice. Okay, good. Thank you very much. So the next question that we are going to discuss is on how do we ensure equitable distribution of resources needed to manage neonatal jaundice. With this, we are going to invite Dr. Entry to start the discussion. Dr. Entry, thank you very much.
Yeah, thank you very much for this opportunity. To effectively manage neonatal jaundice at all levels, it's important that every health facility has the appropriate equipment. And here we are talking of basic things like phototherapy equipment, and then also a good laboratory that can do the basic investigations. Generally, most of our health facilities have functioning laboratories. So the missing link in my view has to do more with the phototherapy equipment. Fortunately, we now have on the market brands that are locally assembled and durable. And my approach to getting every health facility to get a phototherapy equipment, for instance, is to start with the health managers in the hospital. The medical superintendent or the director of the hospital should be lobbied to prioritize getting a phototherapy equipment. You know, as a head of a hospital, no matter the location of the hospital, you still have adequate resources to do certain things. It's a matter of priority. So if the medical director and his team, you don't just talk to the medical director, you lobby the director, you lobby the head of nursing, the administrator, the finance manager, or the accountant. Do that individually and then meet them as a team to see the importance of preventing jaundice and the need to get a phototherapy equipment. That way, once it is prioritized, they would make sure they have that equipment first before, for instance, they change the floor tiles. in an office. I mean, which is important, but not very crucial. The other thing has to do with the local level district assemblies. Again, the district assemblies have enormous power and resources, even in the most deprived districts. And I'll suggest that the approach is to seek audience with the district chief executive, introduce the subject, help him to understand. I mean, break the subject down in layman's terms for him to understand. And then in the assembly, the assemblies have different committees. There's a committee called the Social Services Subcommittee. That committee is responsible for things relating to health, education, women and children, and the social services. And my experience in working in a district was to get the chairman of that committee briefed on the issue. And then you also sensitize your assembly members in the communities, because the assembly members who meet at the district assembly and take the decisions. And so once they've been sensitized, when the matter is brought to the floor, you will lend their support. And the assembly has money. Sometimes the money sits there and then it gets used for other things. You know, so that's what I would ask. And then the next bit is the corporate organizations. I started with the hospitals themselves because, you see, we've had experiences where equipment are donated and they are not used properly, or they are not taken care of. You find, for instance, this phototherapy equipment sitting there. You may go to a place where if the patient load is, they don't have many patients who need the phototherapy. It means that for some periods, it will be lying idle. And you go and find notebooks and registers and other things packed in them. So that you realize that the health workers themselves don't appreciate. But if they have used their own money, which could have been used to purchase something else for the hospital, to purchase the machine, they will take very good care of it. So this approach, the larger picture has to do with the Ghana Health Service itself, procuring the equipment and distributing. That may not happen all the time, but I believe that it's a phototherapy equipment is something every facility should be able to buy. Facilities are able to buy pickups. They can buy phototherapy equipment. Thank you.
So as been said, the hospitals, we have to make sure that, especially if you are a nurse pediatrician, you're a pediatrician in a district hospital, please lobby your med soup. Talk to management. And please, when I'm going to talk management, please go and talk, humble yourself, talk to them, go with data, okay, talk with data. If you go and you talk to a pediatrician, I'm advocating for children, like, why in the phototherapy? Why I did this? You won't get what you want. They like data too, because Ghana Health Service work with data, present with data. Tell them that this is the mortality we are getting. This is the number of newborn jaundice we are getting. We need phototherapy for them. They will listen to you. Don't go into, no, that doesn't work. That is not military zone. Okay, okay, that's wonderful. So Dr. Pari, my very good friend, please, what can you add to this discussion? Thank you very much.
Right. Thank you very much for this opportunity. But I must say that the last few words you spoke, you took them right from my mouth with regard to data. I'll start off by acknowledging what our chairperson said, Dr. Isabella Sego Moses. Mobilization comes before distribution. From the contribution so far, I think we are aware that despite all the national, regional, institutional, let's start from even international crisis that we face, there is still something available that needs to be mobilized. Therein comes the statistics. I have penned down here that we need to start right at all levels, right from the national, and then in our places as advocacies, in the institutions that we work as health workers. We have to make sure that these things, these needs are captured in our budgeting. whenever we are seeking sponsorship, whether it's external or even internal from internally generated funds, we have to have figures, statistics, data to prove that, yes, there's a need. We have to have the relevant data also to show that the interventions that we have in mind do work. We should have figures to support interventions that have been done and success stories, and also point out where the shortfalls have been. I think all these will help as far as mobilizing funds is concerned. Then it's the same data that will be used for the distribution. We have to try and distribute it equitably depending on the burden or the load. Yes, it's neonatal jaundice doesn't have any, it's not restricted to any geographical locations, but I'm sure from the statistics we'll realize that there may be some pockets that tend to have more cases than the rest. We should also bear in mind the burden or the degree of care. It's not every case that's going to end up at a tertiary institution, but invariably those that end up there may need a lot more involvement, a lot more cost. But we shouldn't forget those right at the grassroots, right from the CHIPS compounds, the primary healthcare situation, where more emphasis can be placed on prevention and early management before it even gets there, before it even gets to the more advanced levels. And as we're talking about this, neonatal jaundice is not restricted to only the government sector. A lot of the private institutions also handle it, deal with them, do the best in terms of their capabilities before they refer. We shouldn't sit in the government sector and put our noses up in the air and accuse our colleagues in the private sector of pushing everything down to us and there's no money to be made. That's why they've referred it. We should admit that we have a bit more manpower, we may have a bit more of a knowledge skill. So we should partner with them, help them manage the cases that can be managed, give them adequate feedback so that not every case will end up being pushed to us. And then with regard to the private sector, when we are looking for support, we shouldn't just be looking for support from the government, central government. There's a limit to what is in the kitties there. But then I think with the right collaboration, especially using the media for advocacy, for publicity, there are a few, or there are a good number of private institutions, I'm sure MTN and the like. Yes, talking about MTN, they're also branded yellow. Neonatal jaundice is yellow. This is a win-win situation for both of us. That's sort of, if we put in the right pitch, I think we should get the right support from them, and they will get their publicity for their social campaign. We will get the funds that we need for our patients, and we'll all be happy. Thank you.
That's wonderful. So yes, so the private institutions, we also have to encourage them to get their own phototherapy units, for example. They should also get their own laboratory that can be used to detect these babies with jaundice. So as Dr. Pabi said, you cannot use the physical examination alone to detect the jaundice. So having the equipment to be able to detect is important, and also giving the feedback. Because sometimes when they refer the cases to the tertiary institutions, we see the cases and we don't actually give them the feedback. If you give them the feedback, they will know what they did wrong, and they might correct their wrong. So important for us to do that. So the next we are going to call is Dr. Kwatin. He is from the UNICEF. UNICEF is a bigger organization. They are in charge of policies and other things. So Dr. Kwatin, please, what can you add to this question? How do we ensure adequate distribution of resources needed to manage neonatal jaundice? Thank you, sir. So if you are online, you can unmute yourself and speak. Thank you, sir. You can't unmute. Push for meeting. Host, can you help us with that? So that is so. There are a lot of work that has been done in Ghana here, and they are wonderful work, especially in terms of knowledge, in terms of practices, in terms of perceptions and all that. And then you notice that, yes, in other jurisdictions, the knowledge is not that high. You notice, for example, the work done in the central region, you notice that the knowledge was quite low. However, the studies done in Kolebu and in regional hospitals, that's rate, you notice that the knowledge was quite high, 80-something%. However, most of them don't actually understand the cause. They don't know the cause of the jaundice. And that's one thing that we need to always stress on, that cause of jaundice, telling them why the children are developing the jaundice is so, so important. Good. Okay, so the question, please, could you give us your words? Thank you.
Thank you so much, Dr. Essel, and then good evening to all my colleagues, and thank you so much. I think this is very important. Dr. Entry and the previous speakers have mentioned a number of the things that we need to be able to first mobilize these resources and then think about how to distribute them. I think aside equipment, other things that I think Dr. Isabella mentioned at the start, that the human resource is also very important. And whilst we think about getting the equipment and the tools, the human resource is also another area to look at. Some of the things I wanted to say have already been mentioned, so I'll just focus on just a few. There's this issue about making sure that the babies, when they are brought to the facility, are catered for because we have the equipment that they need. But if you have a look at our essential health service package, you realize that different levels of care have different capacities and what they are expected to do. So considering where a baby is born, I want us to look at the geographical reach, and not just that, also the time to health facility, to time travel involved. It is important that we also look, for instance, if a child has jaundice and is rushed to a CHIPS compound, the recommendation is for them to refer. So as much as we do it, we realize that we need to strengthen the linkages within systems. For instance, there's a district hospital in that area where the linkages, if is done well, help get this child seen as quickly as possible. So for instance, the Ministry of Health is advocating for this network of practice. So as we go on, we look at this. When we do not have all the facilities that we will need at this time, let's see how we can leverage on those that have. In terms of pooling resources, previous speakers mentioned that government cannot do all, and that is very true. If we could also look at the private sector as we are doing, and also the community. I'm sure Dr. Doe can speak to the community component, how community health management committees and the rest help in health service delivery, including demand generation. So if we look at the community as well, they will be able to help get some of these equipment and resources that we need. Finally, I would want to say that in an area where resources are limited, it is important that once the resources are provided, a culture of planned preventive maintenance is built across our facilities, such that when funds are available, we are not looking at replacing per se, but expanding the reach so that every child, irrespective of where they are born or where they seek healthcare, are able to get access to these resources. Thank you very much.
Thank you, Dr. Kwatin. So we want to ask the audience if you have any contribution, any question, just two. The time is fast spent.
So thank you very much. I think mention has been made of providing data statistics. And I can assure you that if I go to most of our facilities, yes, we haven't put the data together yet. But in the facility where I work, for instance, at my emergency room for year 2020, 2021, or 2019, 2020, neonatal jaundice was the most common admittable case in my emergency. And for 2021, it was the second most common case. I can give you the numbers and all that, but I don't have clearance here. So it is that common. And until we became very much aware, it became aggressive in the management. It was killing a lot of babies, especially because they come in very late with brain damage, and then there's nothing you can do. So it's a very common problem. And the reason why we still don't have a lot of statistics is the fact that we are not even capturing it as a diagnosis. So if you go to the GIMS, the Ghana Health Service District Health Information Management System, for instance, until recently, it wasn't part of the diagnosis that was being entered. So then you couldn't have any figures to work with. But I think now that is being captured in order. So going forward, I'm sure the figures will start coming up, and then we all know that it is something that is really affecting children. Thank you. And you mentioned companies like MTN and all that. I think along the line, we tried collaborating with them about 2-3 years ago. Just around that time, COVID came and then turned everything upside down. So I'm sure we will try again because, like you said, yellow man, and it goes with the yellow everywhere. So thank you very much.
Thank you, Dr. Pabi. So very, very important. Even in Kolebu emergency rooms, so if you anytime we compare the mortality and morbidity, you notice that it's quite high. So data is there, but you have to use the data to seek for what you want. That is what we're talking about. Good. All right. Yes, madam.
Thank you. And thank you all to the other speakers for the very good insights. I just want to add on, picking up from where Dr. Kwarten said about the human resource investments. I think that we would have to make health managers would have to make a deliberate effort to invest in the education of the various human resource cadre that we need for the management of newborn jaundice. And that is not limited only to the doctors, but it should cover everyone from the biomedical engineer that services the various equipment through to the laboratory, and then physiotherapists, then subspecialties, the neuropediatricians, all that needs to be invested in. And once that investment is done, because they cannot be everywhere, we should leverage approaches such as specialist outreach to be able to give support to other facilities. We should leverage options such as telemedicine, so that although the baby cannot move, specialists can provide care and direction to medical officers in peripheral facilities who have the equipment but may not have the needed technical knowledge to be able to manage the cases completely. And would also need to, I would pick up from the data end. Data moves everything. Data is what would help with mobilization and then would lead to resource generation and allocation. And the Ghana Health Service has the DIMS platform that every facility is supposed to report everything that they do, whether private or public, into that data management system. Very recently, the data component for maternal and child health has been expanded, and it's become very newborn friendly. And it's important that if we want the newborn to be seen, then we need to put the information there, let us know who is where, are they dying, are they surviving? And then once that data is collated, we can use that to advocate. So would encourage pediatricians working in the space, especially in the facilities, to make sure that their data is entered on a monthly basis. And then they also generate that data to use internally to give feedback to their staff, and also use it to improve systems within, and then also the others will pick it up from the various levels to improve newborn care. Thank you.
Thank you very much, Dr. Isi. Thank you very much, Dr. Isi. I'll just read a comment quickly that's been put in the chat box. Mr. Cosmos Iafi of the Ghana Physiotherapy Association says he thinks forming a multidisciplinary team for early detection and management involving relevant health professionals will be the way to go. Secondly, advocacy and getting corporate institutions to support with logistics. I think these are points that he's buttressing, points that have been brought up here. So thank you, Mr. Iafi. And then we'd also like to acknowledge Dr. Patrick Kuma-Abuaje. He was on the call earlier. If he has anything to contribute, we'll be very grateful to hear from him. Yes, he's the Director General of the channel. I don't think he's on. Okay. Okay, so since he doesn't seem to be on, yeah, he's not on now. Okay, so we'll ask our chairperson to please give us a summary of the outcome.
Thank you very much. I don't know where to start from to summarize. I believe our moderators have done a good job as we went along. They also provided some summaries, but maybe to put a cap on everything, we've had very insightful discussions this afternoon on the two topics.
On the first one about disseminating and sustaining knowledge on newborn jaundice, the discussions have centered around who to engage. So we've seen that we need to engage health workers with an emphasis on midwives, because they are like the first point of call, but also an emphasis on a multidisciplinary approach, not forgetting healthcare managers who are very key here. We also talked about community members and various community groups. I really like the contribution about the need to involve the children and adolescents. They are very powerful agents of change. And when they hear anything, especially from their teachers or from school, it's like a mantra. I never forget my daughter learning about how to preserve electricity power and coming home and making sure that everybody was complying. You leave the light on and she comes and she puts it off and she reminds you. So I think we should really start with them. Also for the fact that eventually they are going to be parents. So when they know right from the beginning, it becomes part of them as they grow up. We've talked about engaging the private sector and working together with faith-based organizations and faith-based leaders. So that's about the who. And then the discussion also talked about where to engage people in health facilities, in communities, in schools. It talked about antenatal, starting even before the child is born. It also talked about media houses. And then how? With the how, the language is very important. That has come out clearly. We need to break down the language with which we communicate. And once I was talking to a pregnant woman who had anemia during my clinic days and was on admission. And I wanted to find out what she knew about nutrition. So I said, what did you hear from, the health workers at antenatal? And she said in Tree, we should eat good food. So I went further to find out what good food is. And she said, like malt, like Milo, that is good food. And we think we have communicated. So we really need to break down, cry, if I can say that. That is about the how. And the fact that pictures are also very powerful. Where we cannot, the issue about the appropriate language came up when Na was speaking about Ghan, about trees. So depending on where we are, we need to make sure that the language is appropriate. But then pictures are sort of universal. In a community like ours, where the languages are so many, pictures speak a lot. But also we need to make sure that the pictures are appropriate and they should be pre-tested. Because from where we sit, there have been instances where we've pre-tested what we developed. We thought it meant everything. And it goes on pre-testing, and our clients tell us something very different from what we intended to depict. So pictures, yes, but let's make sure that they are speaking exactly what we want them to speak. We also heard about the need to emphasize on the complications. Yes, jaundice, your child gets jaundice, but so what? If we can show some of these complications clearly, then we would be making a headway. In our second question about equitable distribution of resources, we have to mobilize the resources first. And who do we engage in these? Yes, again, we go back to our hospitals, the leaders the teams of our head health facility management teams so that they can use some of the IGF. There is money in our facilities, but what do we use them for? And then our district assemblies. Again, the language comes in here. They need to understand what we are talking about. And for district assemblies and our other corporate agencies, the language they understand is money, productivity, human capital. So again, making the language appropriate, but in another way. Okay, then we talked about the resources themselves, beyond the phototherapy units, beyond the human resources. We emphasized here again that it's a multidisciplinary team. The midwives, the doctors, but again, the lab technicians, the physiotherapists, and others also need to be brought on board. And talking about equipment, let's not forget that we need to maintain them. These are just a few highlights of what we've talked about. But I want to end by making some recommendations based on all this. That we have a very useful tool already, our maternal and child health record book. We have things about jaundice in there. Every woman carries it who is pregnant and who has a child under 5. They have this book in their homes already. If they can't read, somebody can read. There are also photos to show that jaundice is a danger sign. So let's make use of that as we look at developing others. And secondly, I'd like to recommend to the society that perhaps we need to also invest in advocacy tools. We have members spread all over the country. We have various capabilities. Not everybody can speak the way we are speaking. Not everybody can use data, but we can have uniform material that they can use when they are speaking to various groups of people, including the district assemblies, including the heads of facilities, and including corporate organizations. Then partnerships, it also came up. Who can be our partner in this work? Private, we've identified some that we've engaged here, but there are many more. We should invest some time in analyzing the stakeholders that we can continue to engage. I was very excited when Doc talked about the MTN. It was on my mind as I sat here and I looked around. Then I said, so do we go for MTN? What about the others? They'll say they are not yellow. Pediatric Society has red. So already we have the 2 big ones. So we should look at things like that, where it's a win-win situation. That's what the language that we in the health sector, we want to do good. We feel sorry for people, and even when they don't have money, we want to spend our money. But the partners we want to engage, it has to be a win-win situation. What's in it for me? And I'm sure that if we look around, we can get experts who can help us to come up with material that will really sell and get those with the money on our side in this fight. This is just a scratch of the surface of the dialogue. I believe that this dialogue must continue and continue beyond the yellow month. Once again, I want to thank all of you for being here with us today, and the society for putting this together, and to say that let's have more of that so that our newborns can survive and thrive, move from yellow to being heroes. Thank you very much.
Thank you, Chair. Thank you, Madam Chair. We are bringing to an end this session of the program. The next is to project the Jaundice Pledge so that we all go through and abide by the words and work accordingly. Thank you very much.
We'll all recite the Jaundice Pledge. If you could please be upstanding and say the words meaningfully. Okay. Can we please put the lights? Can we please enlarge it a little bit and then put the lights off? Okay, is it better? Okay. So can we start? I, Hannah Sharon Mills, pledge to support efforts to reduce brain damage and death from neonatal jaundice. I know that I have a role to play and will do all that is within my power to ensure that no baby suffers from preventable disability or death caused by newborn jaundice under my watch. I am deeply convinced that I am an essential part of the solution. I will constantly upgrade my knowledge to the benefit of these newborns. I am determined to play my role in educating the public about newborns and jaundice. I will advocate for good laboratory services and phototherapy equipment for health facilities. I will promptly refer babies who may require specialist care for newborn jaundice. Our babies will thrive as I consistently fight for them. I know our newborns are counting on me, and I will not disappoint them. So help me God. Okay, so thank you all very much. We've come to the end of the second part of our program, and now we are going to move on to the Jaundice Fair. So I call Dr. Adjoa Amamo to come and lead this part of our program. Adjoa.
Good evening once more, everyone. Thank you so much for your participation, everyone, here live in person and also on Zoom and YouTube and all those following up. We've done so much and we're here at part 3. We're here to see the fair. We just spoke about the pledge and we promised to advocate for phototherapy equipment and for facilities that would help to manage and treat and prevent disability and death from newborn jaundice. And that is why we are here today at the Newborn Jaundice Fair. This fair aims to bring together health facilities, medical workers, and then also companies and individuals who are involved in procuring and the sale of quality, trusted equipment that will help to prevent disability or death from newborn jaundice. So without much ado, we will start with our first presentation from Home Phototherapy Services. And Dr. Adeline Asante-Kwabea, are you online? Let us know if you're online, Dr. Asante-Kwabea. Yes, she's online. Yeah. Can we have the first presentation? We're having our first virtual presentation from Home Phototherapy Services.
Okay,
Hello, Adeline.
yes, hello. Yes, I've been unmuted now.
Over to you.
All right, thank you, Adjoa. Hello, everyone. I think it's just as the name says, home phototherapy services. This is a service that brings phototherapy services right to the homes of mothers of newborns who have jaundice. And the whole aim of it is to reduce the amount of stress that mothers who have just had a baby go through when they have to do phototherapy in hospital. So it's meant for babies who are actually well. Otherwise, if not for the jaundice, would have been sent home. So not medications or IV fluids fell. And for mothers who may have in the best positions to share a ward to therapy for a day or two. This brings the equipment right to the homes of the parents so that they can, in the comfort of their homes, get their babies to have phototherapy whilst they also are able to relax. And in that environment, it will enhance their lactation, ensure that breastfeeding goes on well, and the baby recovers from jaundice without much difficulty. There are various equipments that are available. The choice was for a Firefly to ensure that within the shortest possible time, the intensive phototherapy is delivered, and then the baby, the parents don't have to keep the baby under photo for so long. And then also it's handy and portable, so it makes it easy to move around. How it works is that the health worker who is involved in the care of such a child has identified a child who may benefit from home phototherapy services, particularly a doctor or a midwife will contact home phototherapy services. And then the baby will be vetted the criteria to have phototherapy. The equipment is sign an agreement which explains what the phototherapy is about, how it's supposed to be done, what the possible complications could be, and then what could happen if the baby does not get the required phototherapy, and then alternative methods of dealing with jaundice other than phototherapy. And then if they agree to the terms and the conditions, they sign, and they are taught how to operate the equipment, and the baby is put under phototherapy. After 24 hours, the doctor or midwife who's responsible for their care will get in touch with them, and they would have a repeat serum bilirubin test done to see whether the levels are dropping as is required by whoever is in charge of their care. And then when they confirm that the levels are at acceptable, the bilirubin is at an acceptable level, then they contact home phototherapy services, and then the equipment is picked up again from them. It costs 300 cedis for the first 24 hours for the service, and then every other 24 hours that adds on is at 150 Ghana cedis. The initial of as well, so delivery of the equipment to the home and then the pickup of the equipment is considered. So we're hoping that this will be for parents and also reduce the crowding that sometimes happens in our emergency rooms and wards when we have such babies who only need phototherapy. So thank you very much for your attention. I'll take any questions if there are any.
I believe because of time, we cannot take in-person questions now, but you can put your questions in the chat box and it will be adequately addressed. So if you have any questions for home phototherapy services, please address it in the chat box and they will answer you. Thank you. So we're moving forward. We've saved the best for the last. We have another trusted friend who is also collaborated with us for several years now in this newborn jaundice fight. And they are here with us once more. They are well known for their very famous phototherapy equipment. And once I mention, I'm sure you will figure out who they are. They are here, and this year, they have not just brought their Firefly, which we all know, they've expanded their spectrum of jaundice and phototherapy equipment to include a light meter and some other colibri devices. It's all very interesting. They even have these very cute eye patches. I think I'll move to Africa Health Supplies, and they will come in and do the second virtual presentation online. We'll have Mr. Albert ACCRA doing that with us. Thank you very much.
Right. Thank you very much, Doc, and very good evening to everybody. I hope you can hear me. I hope everybody can hear me, please. Okay. I believe that's a yes. So thank you very much once again for the opportunity to be with you. We are definitely always at home with Pediatric Society of Ghana, and it's always a pleasure to join you for these sessions. I'll go straight to the point because our time is very, very brief. I have a very lengthy presentation, but I will just try and keep to the essentials because I believe that our brand and equipment is very well known to the Pediatric Society of Ghana. So I'll just mention a few things which are a bit new with our work. So if you would kindly jump to page 6, I think slide 6, then I can talk about the products. Yeah, then I can just talk briefly about the product. So basically, our most popular brand is the Firefly Phototherapy equipment, and definitely that's a double-sided phototherapy machine and works very well to reduce bilirubin levels. As Dr. Momo mentioned, we also have the Colibri phototherapy machine, which pretty much works like the Firefly, except that the design is different and it's also very effective. I want to also mention that we also have our warmer, the Radiant Wallaby Radiant warmer, which works to keep our babies warm when they are undergoing phototherapy and fastens the process of healing for our babies. We've also gone into advanced care, and by that we have the Dolphin CPAP, which I'm happy to note that a few of our health facilities, a lot of the private hospitals have it, as well as some of the public hospitals as well. And it works very, very well to provide the advanced care that is needed, particularly for our babies who are born preterm. Of course, the light meter is the equipment which checks the radiance, whether the baby is getting the right radiance for effective phototherapy. So that is also on offer. Of course, we have special hand sanitizers, and I think Kolebu Teaching Hospital is very popular with using a hand sanitizer, and we have a lot of that also in stock. And then, of course, not forgetting our eye patches, which come very much in handy to ensure that the baby is well protected whilst they are undergoing photo. I'm sure that we are very much aware that we've in the past done a lot of CSR donations. Last year, particularly, by the end of the year, we started from January. By the end of the year, we had donated 40 equipment to various hospitals and organizations and health facilities across the country. But let me also mention that the majority of those went to hospitals in Ghana because we had a sizable amount of about 6 equipments, which were also donated outside of the country, to Nigeria and then also to Liberia. But a chunk of the equipments were donated free of charge to most of the hospitals in Ghana. And I'm sure those who are beneficiaries can attest to the support that we've been giving health facilities over the years. particularly this year, we couldn't do donations because I'm sure you all know the challenges that has had to do with the economy and particularly a dollar fluctuation to the city. But what we've been able to do, ladies and gentlemen, is to give a good price reduction. So between now, we actually started from, throughout the month of May, between now and the end of May, Firefly is going for a flat rate of 25,000 Ghana cedis. So that is what we have been able to do. In fact, we were not actually going to be able to do that, but we've got a lot of calls from our patrons, our friends, and so that is what we've had to do, because I think between some time 2 months ago, especially when the dollar fluctuated, our prices were even hovering almost around 28,000, 30,000. But we feel that we have to be able to do something, particularly within this month. And so we are doing this flat rate. So we would definitely encourage donors, who encourage hospitals, partners who can be able to mobilize to take advantage of this offer. I also want to make a quick mention, because I couldn't help agreeing more with the presenter who talked about lobbying hospital administrators and particularly corporate Ghana. And I think that as pediatricians, we are in a best position to be able to do this lobby. Sometimes I feel that if we consider the debilitating effects of jaundice, and you are the ones who deal with it first, and you see all these babies who didn't really ask to be born, but they get born and they have to go through, some of them have to go through lifelong deformities. We have to do everything possible. And I definitely agree with the lines, the stanzas in our pledge, that we have to do more than what we do. So I want to encourage all of us, as corporate organizations, as ourselves, we always also look for opportunities, look for funds elsewhere to be able to make more donations. And as and when we are able to, we would definitely be more than happy to do that. I think in conclusion, I just want to take the opportunity to also congratulate the society for being at the forefront of championing, advocating, and ensuring that the powers that be, the decision makers, hear and take seriously the issues of neonatal jaundice in our country. I have no doubt that if we keep on this trajectory, very, very soon, we shall have a zero jaundice in our country. So thank you so much for always supporting us. And we also always promise to be very reliable partners to the Pediatric Society of Ghana. Thank you very much, and God bless you.
Thank you so much, Mr. Albert ACCRA. I am particularly fascinated by this eye patch. It looks like a very cozy little bra. I'm sure the baby will sleep. And it has a nice adjustable strap, so it doesn't matter how small the baby's head is or how big. Yeah, babies would feel real comfortable with this. No more gauze.
Well, I can assure you the babies have been really, chilling out in those eye patches, and they're always happy to be in it.
I should buy one to sleep. Thank you very much. So this is their stand. We have an exhibition going on live. If you are around after the program, you can come by to the stand, ask questions, and they'll be here to help you. Thank you. So I think we've had so much time spent, but fun doesn't last forever. We're moving on to the next segment. I'll hand over back to Dr. Hannah Sharon Eskin. Thank you very much for your time.
Okay. Thank you, Adra. Okay, so I just want to acknowledge a few people. We had a lot of people joining us via Zoom and via YouTube as well. In particular, I want to acknowledge Dr. Frank Srebo. He's the president of the Ghana Medical Association and a member of the Pediatric Society of Ghana. He's been with us right from the beginning. Dr. Srebo, thank you very much. And then we'd also like to acknowledge our president, the president of the Pediatric Society of Ghana, Dr. John Adebiapia. He's also on. Dr. Adebiapia, I don't know if there's anything you want to add to everything that has been said so far. If you do, you can please unmute and speak.
Yeah, thank you very much. I'm enjoying the program so much. You guys are doing awesome job. So I'll let you flow.
Okay, so thank you
You
very much,
too.
Mr. President.
Thank you very much.
Dr. Sripa, please go ahead.
Oh, I'm done. I just say thank you very much. I've been
Okay,
struggling
thank
through
you.
it, but I think you guys are doing well. It's been a wonderful program. The setting is so beautiful. And I wish we could have done this in person rather than a few of you enjoying that beautiful setting. So I'm here at the airport, but I'll try and be here till I'm unable to join anymore. So thank you.
Thank you very much. Okay, and we had, at a point, we almost had 100 participants. So thank you to everyone who joined us via Zoom. Thank you all for your contributions. I'll hand over now to the Yellow Month Committee Chair, Dr. Hilda Mantebia-Boy, for her closing remarks.
Thank you very much, Dr. Hannah Sharon Eskin. It's evening now, I believe. Good evening, everybody. And it's wonderful to see you all here. I bring you greetings from the executives of the Pediatric Society of Ghana and also from the members of the Yellow Month Committee 2022. We've had a wonderful month of advocacy for the last 5 years. It's been just awesome. We keep going and going. I'd like to say a big thank you to those who have supported us for all these years, and especially for those who have also given us some funds to be able to buy the phototherapy equipment for the One Region, One Set of Phototherapy Equipment initiative. Today has been great. We've had a first part, which was the opening. We've had a second part, which was the roundtable discussion, and the third part, which has been the newborn jaundice fair. Indeed, we are preparing to wrap up the month, and on Friday, we're going to have a meeting as members of the Pediatric Society of Ghana to take reports from the various regions. We've done this for 5 years, and newborn jaundice is a problem everywhere, but especially in Africa. And we look forward to a time when it will be celebrated across Africa. Our problems are similar. The issues with newborn jaundice, if you speak with those who are from Malawi, from Kenya, from many of the African countries, is the same. So we are hoping that it gets bigger and bigger, and the newborns eventually will win at the end. Thank you all very much for joining and for constantly supporting us. God bless you and have a good weekend.
Thank you, Hilda. And since we are coming to the end of our meeting, there's just one more thing we need to do. We want to take a group photograph, and then after that, we'll have our closing prayer, and then we'll do our refreshments. So for those of us who are here, you can all come and stand in front underneath the banner. So please, let's come forward.
Okay, so the Zoom people. Okay, so we won't also take picture on Zoom. Those on Zoom, please, admin, could you organize the people on Zoom so we'll get a picture from them? We also want to acknowledge some organization and other individuals who have supported us to buy phototherapy units for various institutions. We acknowledge Wegehe class of 1975. They help us in buying phototherapy units. So Wegehe, you can bring more. Wegehe, please bring more. Wegehe in the house. Yeah, raise your hand, raise your hand. Good, wonderful, great, great. We also acknowledge AHS. AHS, they help us a lot in getting phototherapy units. So please clap for. And also Rotary Club East Accra. Rotary Club East Accra, they've helped us a lot. Okay, so let's clap for them. We thank them, but we always ask for more, Oliver Twist. So please, they should bring more. Thank you very much.
Okay, so we started with a prayer. We're going to end with a prayer. So Dr. Gabi Obeng-Kranting, could you please give us the closing prayer?
Shall we pray? We pray in the name of the Father, the Son, and the Holy Spirit. Almighty Father, we thank you so much for being with us during this wonderful program. We have heard so much, we have learned so much, we have made a lot of ground in relation to neonatal jaundice. We pray and ask that as we leave here, we'll be able to continue to spread the word, that we're able to continue to do the good work that we have started for our newborn babies, so as to prevent this jaundice menace and all the debilitating effects that it has on our children and the country at large. We also pray for traveling mercies on our journeys back home. We pray also committing all those who joined us online into your care. And we ask that you grant us a wonderful weekend so that come Monday, when we go back to work, we'll have all the energies to start all over again. We thank you for our media partners who also came to grace the occasion and cover the program. We thank you so much for an answered prayer. In Jesus' name we pray thanksgiving. Amen. Okay, so I think those of us who are eating here, we've been given coupons for dinner. If you are eating here, if you indicated that you were eating here, you don't have a coupon, kindly let us know. Those who are taking their packages home, they will bring the packages up here shortly, and then we'll share them. Thank you.